Do you suffer from tingling, from brain fog? Do you suffer from tingling in your extremities? Do you suffer from pains, from weakness, from nerve degeneration that may not be a multiple sclerosis type of severity of disease? Do you suffer from different ailments in your body, pains in the bone, pain in the muscle, and the doctors can't find the causes? Maybe they ran a blood test for Epstein-Barr virus, or maybe they found that you have a certain immune cell count that's not perfect, but they can't tell you why it's happening. I'm Dr. Lonnie Herman, and in this video I'm going to share with you some findings which will, for most who come in here and get exams, it's startling to them how we can find out what's going on in their tissue and how they feel rapid changes and improvements in their health. In this video, I'm going to share with you my first exam on a patient who came to me from another state here in Florida, in the United States. And what I found is that her hemoglobin, the oxygen-containing part of her blood cell, is infected and toxic. What happens when there's supposed to be, let's say inside your red blood cell, in the hemoglobin part of the red blood cell, there's supposed to be 50, let's just say there's 50 soldiers of oxygen in there in order for your brain and your body parts to function appropriately. In order for you to have no malfunction, no memory problem, no brain fog, no chronic fatigue, you need to have all 50 soldiers of oxygen in every red blood cell and all 50 soldiers of oxygen, molecules in other words, that are going into the cell to feed every cell in your body from brain to toe. What happens if you expect to have 50 in there but you only have 15 in there? What if there are only 15? Because the other 35 can't get into that red blood cell because there's infection inside the blood cell, toxin inside the red blood cell that's robbing the space that is competing with the oxygen, and then they win. And even if your red blood cell test shows normal, your blood cell laboratory range may not fit what your body really needs, because the range of low to high, they may really let a D- grade for a hemoglobin count to pass. What if your body needs a 90 to 100? What if your body can't survive normally, the way you expect optimally, in other words, when you have a score of, let's say, an 81 on a test? Let's say your hemoglobin is, I'm making the numbers up here, let's say you have a score of your hemoglobin of an 81, but for your brain and your body and your nervous system and your muscles and your bones to function the way you expect them to, you need at least a 91. But the doctor who ran the blood lab sees a lab range and says, hey, you're normal. And let's say that lab range gave you a score of an 81 or a 79, and they say you're passing. But your body says, I'm not passing. Something's wrong with me, and the doctor can't figure it out. Well, it's all in your head. Well, we can't find the cause. Maybe you need to see a psychiatrist. That's what I hear from patients. And this woman on this day, she came in because she's got pain in the arm, asthma. She had a uterus problem. She has a problem holding her head up. She's got a problem with memory. She's got bad neurological symptoms of tingling and weakness, and there's been no real answers of why the suffering. Yes, they ran some blood tests and found immune reactions. They found low and high blood cell counts, but they can't tell why. We need to know why these changes in the blood cells on a blood test are occurring. Why? Not that we see that we can count a blood cell of an immune reaction that's taking place. We need to know why it's taking place, not that we see that we can find it on a blood test. Is that making sense? If they see that there's an immune reaction, so we see an elevated white blood cell count or a complement C3 or C4 count, if you're familiar with those, if not, just understand there are different markers on a blood test that will say that there's an immune reaction taking place in the body, or there's an immune deficiency. Why is it happening? That's what we have to find out. Because you can have all the results of all these most impressive looking immune reaction blood tests done, but still not know what is causing it. In her hemoglobin on this day, with my kind of testing that I run in my practice, I found mercury fillings from the teeth inside her hemoglobin. I found arsenic, which can come from soil, from rice, from chicken. Arsenic inside her hemoglobin. Poison inside the red blood cell, robbing the space of the oxygen, robbing the ability of the brain and the bones and the nerve and all the muscles and the thyroid and everything from getting enough oxygen supply, because there's arsenic in there. I found silver and mercury compounds. I found multiple mercury compounds inside there. I found lead inside her hemoglobin, robbing the space of the oxygen supply to her tissues. I also found side effects from the measles, mumps, and rubella vaccine. I also found multiple parasitic infections invading her red blood cell hemoglobin. I found the DPT, diphtheria, pertussis, tetanus vaccine inside her hemoglobin, robbing its ability to function the way she expects it to. And her blood test looks normal for hemoglobin. I found the Lyme infection called Borrelia burgdorferi infecting her hemoglobin. More multiple vaccines affecting the hemoglobin, Babesia microti parasitic infection inside the hemoglobin, robbing the space of the oxygen. I found Candida glabrata inside that hemoglobin, another fungus called Cryptococcus inside that hemoglobin, influenza B virus inside the hemoglobin, influenza A, herpes zoster, Coxsackie virus, Epstein-Barr virus. We found on this day influenza B, influenza virus, herpes zoster, Coxsackie virus, Epstein-Barr virus, and parvovirus inside the red blood cell, causing lack of oxygen in the hemoglobin, robbing her tissue's ability to get the oxygen supply that she really needs in order for her to function the way she's supposed to. I found antibiotic residues inside her hemoglobin. What do you think is happening to the tissues when there's not enough oxygen getting to the tissue? Is it normal? Is it normal? Is it better than normal function or below normal function? Which do you think? I would say below normal function when you can't get enough oxygen supply. Do you think that it's a good place, a prime area for cancer to develop? Yes. Less oxygen to a tissue, more cancer can develop. Do you think that these infections and toxins in the red blood cell are going to be delivered to your bone and your heart and your thyroid and your parathyroid and your testicle or your uterus or your ovaries or your prostate or your lungs or your teeth or your brain? Do you think that these toxins and infections are going to be delivered there? Or do you think that they're going to stay in the red blood cell and it just moves through the system, not letting out those infections and toxins into your tissues? It's letting the infections and toxins get into your tissues, and it's also not allowing enough oxygen to get to your tissues. And that's what's happening with her. I'm going to see her in close to 4 weeks from now. I expect to see some changes. I don't know exactly how and what kind of level of change she's going to get, but there is going to be change. Because we're also supplying her. One thing that I didn't mention already is that hemoglobin is experiencing a lot of wear and tear. So there are specific remedies, in addition to the remedies I'm supplying her to get these infections and toxins out of her hemoglobin, specifically targeted to get it out of the hemoglobin. She's also got some specific remedies to help the hemoglobin raise its function, to raise the ability of that hemoglobin to function the way it's supposed to, which would be delivering the perfect nutrition, the perfect oxygen supply to her tissues, brain to toe, everywhere inside the body, skin included. So I expect to see her back and follow up with her, whether it's long distance or in person, in the next close to 4 weeks. And I look forward to hearing some changes. Look forward to seeing her update. I will share that with you here on video. Just know this, even if your blood cell test shows that you have a normal red blood cell count, or if it's low, or there's a normal hemoglobin, or if there's low hemoglobin on the blood cell test, you've got to be able to find out what's in that hemoglobin. These findings inside the hemoglobin are like a ball and chain, like a 50-pound lead weight around your leg that doesn't let your body move the way it's supposed to. Just imagine you had a 50-pound lead weight tied to a ball and chain around your right ankle. You're not going to function too well, are you? You could take a lot of B vitamins. You can go for infrared saunas. You can take amino acids. You can do enemas. You can do all different things. You got to get the ball and chain off your leg. She's going to get the ball and chain off of her red blood cell with this round. There may be a few other things that show up in the next round of testing, maybe, but I expect to see the majority of these gone. The mercury, I doubt it. The dental amalgam, I doubt it, because she still has 2 teeth in her mouth where there's mercury, and we're not going to go after that yet. We got to get the mercury out of the teeth before we're going to get the mercury out of the red blood cell. Share this video with somebody you know, who you love, who needs help with chronic fatigue, who needs help with brain fatigue, who needs help with brain fog, who needs help with pain, where the doctors are not figuring it out. I can help them do that. I can help you. Share this video. Click the subscribe button on my YouTube channel. I put up videos here all the time, probably almost on a daily basis. I'm putting videos up here about the research I do in my clinic and the type of treatment programs I offer patients and the type of recoveries too, because there are a lot of testimonials I get from patients who are showing just rapid, amazing recovery from their chronic, many years of ailments. Also, like us on my Facebook page, because I use that every day to share this information and help people stay in tune with ways that they can find to reverse their chronic disease, whether it's lupus, MS, thyroid disease, dementia. There's just tons of ailments. Arthritis, rheumatoid arthritis, we help them all. I look forward to sharing more information with you. Thank you for coming in to watch this video and letting me in your home or your place of work to share this information with you. And I look forward to sharing more. See you soon.